Take a look at this image. As you're looking at the face of this child, ask yourself, what's this child thinking? And what are they feeling? And if you can turn the spotlight back on yourself, ask, what are you thinking and what are you feeling as you look at this image? Now, what I've just asked you to do is in essence what we call mentalizing. In other words, the process of making sense of self and of others in terms of underlying mental states. It's a process that it's so natural, we're doing it all of the time, that it's easy to forget how central and how important it is for a child's developing sense of self, for their capacity to manage emotions, and also to navigate the social world. 2 decades of developmental research has really helped us to understand how children and young people develop this capacity to mentalize, but also to understand the role that mentalizing difficulties play in a whole range of common mental health difficulties. That's why therapeutically we're increasingly coming to focus on supporting this capacity to mentalize, whether that's in children or in their carers or indeed the whole network around children. Here at the Anna Freud Centre, we've developed a range of professional trainings that can help you develop the skills to incorporate a mentalizing approach into the work that you do, so that we can all make a difference to the lives of children and young people.
We have a number of different mentalization-based trainings at the Anna Freud Centre for professionals working with families, including young people, children, carers, parents, or whole families. They all have the same thing in common, and that is the mentalization-based theory. They all take a slightly different approach. Some are designed for people working, say, with just parents or just foster carers. Others are designed for professionals working with whole families. And equally, we have a training for those professionals who are working with children on their own or with children and parents in parallel. The mentalization-based approach is used not just in relation for how you're working with these families, but also it's used for thinking about how you mentalize yourself. We know that mentalizing is a very fragile capacity. We're all probably only mentalizing about 30% of the time. And if we're working with complex families, particularly those where there's a history of trauma or attachment difficulties, we know that our capacity to stay online with our mentalizing is going to be compromised. And so what we do in the trainings is we help you to think about how you mentalize yourself, also how you mentalize your colleagues, how you use the common framework within your teams of the mentalization stance. And we train you in that in a number of different ways. One way is that you can observe the trainers practicing these techniques with each other or on videos. The other is through your case discussions. We encourage you to bring your material to the courses, but also to practice some of the techniques and tools that we're going to give you in these trainings with each other in a group or in dyads in the trainings. We hope that you find them really relevant and useful to your work with children, young people and families.